All right, so now let's do our Tensegrity in action activity. So this is actually a demonstration of the power of treating one of the myofascial slings or the myofascial meridians called the superficial backline. On the right-hand side, there's a enlarged picture of that, and I'm going to walk you through that in the next slide. I actually have a video of me walking you through this activity. On the left-hand side, you're going to see the plantar fascia. That's all of the muscles and intrinsic kind of fascial connective tissue and intrinsic muscles of the bottom of the foot. We're actually going to treat the bottom of the foot. So what you'll need to do is just get an object, which I describe here in the next slide, and follow along with me as we go through this. Now, mind you, I'm going to actually have you stretch first. So just follow along, hold that stretch, and we're going to go through all these instructions here, so you don't have to read them right now. Just follow along on the next slide. Hey class, so I wanted to walk you through the Tensegrity in action activity. So we're going to do what you'll see here is on the right hand side, we're going to look at the superficial backline. We're going to assess our superficial backline. And then on the left-hand side, we're going to roll the bottom of our foot and reassess our superficial backline. So before we begin, you go ahead and pause this video. I need you to go get something, some object. So I've got a rolling pin here. This is a hard dowel. You can use that. A lacrosse ball, this is a trigger point therapy ball, which you probably won't have. Even a golf ball. What doesn't work well is a tennis ball because it's so soft. So I need you to find something that's relatively firm. Look, you can get on Amazon and buy a lacrosse ball for $5. And this ball's really, really hard. It's a rubber ball. These are great because you can use these in other places. So maybe consider treating yourself to a lacrosse ball. But find something around the house. It can even be a dowel. It just has to be able to roll. And this is my rolling pin. I don't do a lot of baking, but in the event that I do, I have this. So what I need you to do is grab your object, your ball, and I'm going to walk you through this, and we're going to talk through this as we do it. So I'm going to move the camera down here a little bit so you can see my feet and hopefully me. Okay, can't really see me, but I'm going to get down here on my knee. So first thing first, take off your left shoe. So I'm taking off my left shoe. We're going to start on the left. Actually, sorry, leave that on. Don't take it off yet. Forgot one thing. So what I need you to do is I need you to actually do a stretch. So here we go. So this standard stretch, you've seen this before. Everyone's like, well, this is for your hamstrings. But what I want you to do is notice how I'm tucking my chin to my head, to my chest, excuse me, chin to chest, and I'm just hanging here. Now I want you to try and go as far down as you can. Keep your feet flat on the floor. Try and touch your toes. Keep your legs, they don't have to be perfectly straight, but I want you to get a nice stretch. But while you're doing that, I want you to, so go ahead into this position. So everyone should be in this position now, listening to me. Tuck your chin to your chest. I'm going to walk you through the superficial backline. Okay? It's the plantar fascia. So I want you to get a comparison between left and right leg. Left and right. I want you to compare the bottoms of your feet, which is the plantar fascia. Compare left and right on your Achilles tendon. Maybe straighten your knee out. Compare left and right on calf. This is actually the soleus, is the lower calf. The gastrocnemius, which is the upper calf. Remember, keep your chin tucked. Through the hamstring. So compare left and right. Get a sense of the tension between left and right on either leg. Through the back of your hip, there's what's called the greater tuberous ligament, which is right up here. Through your thoracolumbar fascia, which is all of this connective tissue here, and the erectors of the spine. So they go all the way up your mid-back, all the way up your upper back, all the way through your neck, all the way to your skull, all the way to the front of your eyebrows, above your eyebrows, called the brow ridge. That's all fascia connections up here. Look on the right, you see the skull facing you. That is got the little brow ridge and the fascial connection. So I'm comparing left and right. Okay, get a good sense of tension. Where do you feel it? Might feel like a good stretch. Okay, now let's pause. Now, take off your left shoe. That's what I meant to have you do. So my left shoe is off. For the record, left shoe is off. Get your object, so whether it's a rolling pin, lacrosse ball, golf ball, it's got to be something that can roll. So a baseball won't work that well. If all you have is a tennis ball, I'll take it, but I'd like something harder. So you're going to put that object down on the ground, and I want you to take your left foot. Now look at the module. To my left, to the camera, or to I think it's this way. I'm trying to think which way it'll be. To this side, you see that bottom of the foot. That's the plantar fascia. And what I want you to do is I want you to see where the triangle is. I'm going to roll from the heel, through the arch, through the forefoot, through the outside of the foot, and I'm looking for any tender spot. So when you find a tender spot, what I want you to do, and I'm going to stand up, I want you to lean into it. Okay? I'm going to actually come up back a little bit further so we can get a little bit more of me in my head. Okay? So I'm leaning into this, I feel a tender spot. The tenderness should be a 7 out of 10 in discomfort. 10 being excruciating. I hate you, Professor Parcelletti. I can't believe you're making me do this. 7 should be tolerable. Now, one of the things we talked about is that your pain pressure sensitivity decreases as the more you do this. So you'll find that if you hold this for 30, 60 seconds, it doesn't hurt as much. And then you're going to find another spot. So find another spot in there. And I want you to put some pressure on that. Roll through it. Only do one foot. I'm trying to demonstrate something cool to you. So don't do the other foot. Okay? Still on the left foot. All right. Find another spot. So remember, we talked about all of the connected nature of the superficial back line. So the theory goes, and hopefully the reveal on this will be interesting for you, is that because of the interconnected nature of the superficial back line, from the bottom of the foot to the Achilles to the soleus to the gastroc to the greater to the hamstring to the greater tuberous ligament to the thoracolumbar fascia through the spinal erectors, all the way through the fascial of the skull and the brow ridge, that we're going to feel some sort of change somewhere up that entire line. Find another spot on your foot and find a tender spot, and I want you to put some pressure on there. It may be good just to go back and forth. That's okay too. But I got one right in the middle of my foot. Ooh, that's tender. Now, just remember, this is the one time when discomfort is okay, that pain is okay in fitness, when you do some of this ischemic compression. That's a fancy term for just pushing. Like a massage, you can push on that, and that's what actually creates a little bit, or decreases the viscosity. It makes the fibers slide better over themselves. So the pressure is actually not a bad thing, and the discomfort isn't a bad thing. What you don't want is pain in your back or pain somewhere else from just doing the stretch, but this should be probably uncomfortable for most of you, and it should be 7 out of 10 in discomfort. Find one more spot for me. I just want to make sure that we're getting this. Check the base of the heel. So before you go onto your heel, I'm really on the base where my foot meets my heel. Sometimes that's a tender spot for me, or maybe in the arch. So check a spot there, roll through it, hold it for another 10 seconds. 9, 8, 7, 6, 5, 4, 3, 2, 1. All right, pause. Put your shoe back on. Okay, whoops. So go ahead and put your shoe back on because I want to make sure you're even. Go back into your stretch. Tuck your chin. Same stretch. And compare left and right. Does it feel different? Does the left side, maybe up the chain, feel different than the right side? I don't know, you tell me. Okay, that's one thing we could do. Now what I want you to do is, go a little higher here so you can see me, is hop on your right foot, which was the untreated foot. Okay, make sure you don't trip on your shoelace. And then hop on the left foot, the foot that we treated. Ooh, that feels way different, right? Do you notice the difference? The foot feels more receptive to movement. It feels like it's in better control. The tissue's activated and warmed up and turned on and ready for the movement. So, hopefully you felt something. In discussion, I would like you to share what you're experiencing, how it worked, and we're going to do some other foam rolling along the way here. So check some of that stuff out and then tell us how you felt after your experience with foam rolling.